Question 1. A nurse is caring for a patient receiving 4 vancomycin. Which assessment requires immediate intervention? A. The patient reports tinnitus. B. The patient's creatinine is 0.9 milligrams per deciliter. C. The patient has a flushed face. D. The patient's blood pressure is 122/76 mmHg. Answer. C. The patient has a flushed face. Question 2. A client with heart failure is prescribed digoxin. Which finding is most concerning? A. Apical pulse of 58 BPM. B. Potassium level of 4.0 milliequivalent/L. C. Blood pressure of 130/82 mmHg. D. Digoxin level of 0.9 nanograms per milliliter. Answer. A. Apical pulse of 58 BPM. Question 3. A nurse is administering metoprolol. Which patient statement requires priority investigation? A. I feel dizzy when I stand up. B. I have a history of asthma. C. I take it every morning. D. I avoid grapefruit juice. Answer. B. I have a history of asthma. Question 4. A nurse receives orders for a patient in pain. Which medication order should the nurse question? A. Morphine sulfate 4 push for a patient with a respiratory rate of 8. B. Acetaminophen 650 milligrams orally every 6 hours. C. Ibuprofen 400 milligrams with food. D. Hydrocodone 5 milligrams for pain rated 7/10. Answer. A. Morphine sulfate 4 push for a patient with a respiratory rate of 8. Question 5. Which patient should not be assigned to a UAP, unlicensed assistive personnel, when administering medications? A. A patient who needs blood glucose testing. B. A patient requiring eye drops. C. A patient who needs an insulin injection. D. A patient who takes oral vitamins. Answer. C. A patient who needs an insulin injection. Question 6. A nurse prepares to give warfarin. Which lab value is most important to check first? A. Hemoglobin. B. Platelets. C. INR. D. WBC count. Answer. C. INR. Question 7. Which patient is at greatest risk for lithium toxicity? A. A patient with stable sodium levels. B. A patient taking diuretics. C. A patient with normal renal function. D. A patient who eats a high-salt diet. Answer. B. A patient taking diuretics. Question 8. A nurse is delegating to a new LPN. Which task is most appropriate to assign? A. Teaching a patient about insulin administration. B. Monitoring a patient receiving forheparin. C. Administering oral antibiotics. D. Starting a central line. Answer. C. Administering oral antibiotics. Question 9. A patient receiving phenytoin reports gum swelling. What should the nurse do first? A. Document the finding as expected. B. Notify the healthcare provider. C. Withhold the medication. D. Encourage oral hygiene. Answer. D. Encourage oral hygiene. Question 10. A nurse gives naloxone to a patient who received morphine. What is the priority action? A. Assess pain level. B. Monitor for respiratory depression recurrence. C. Record intake and output. D. Notify the provider immediately. Answer. B. Monitor for respiratory depression recurrence. Question 11. Which patient needs immediate assessment when receiving furosemide? A. Reports leg cramps. B. Urine output of 1,500 milliliters in 8 hours. C. Blood pressure of 130/76 mmHg. D. Weight loss of 2 pounds in 2 days. Answer. A. Reports leg cramps. Question 12. A patient asks why they can't stop prednisone suddenly. What is the best explanation? A. It may cause weight gain. B. You may become immune suppressed. C. It may lead to adrenal crisis. D. You could have rebound inflammation. Answer: C. It may lead to adrenal crisis. Question 13. A patient prescribed albuterol is experiencing tachycardia. What is the nurse's best action? A. Hold the next dose and notify the provider. B. Administer a beta blocker. C. Encourage rest and monitor. D. Stop all inhaler use. Answer: A. Hold the next dose and notify the provider. Question 14. Which medication order should the nurse question in a patient with a penicillin allergy? A. Azithromycin. B. Cephalexin. C. Levofloxacin. D. Doxycycline. Answer: B. Cephalexin. Question 15. A nurse is reviewing a medication order for levothyroxine. Which instruction should be included in patient teaching? A. Take with food. B. Take at bedtime. C. Take on an empty stomach in the morning. D. Take with calcium supplements. Answer: C. Take on an empty stomach in the morning. Question 16. A patient receiving enoxaparin asks about bruising at the injection site. What is the best response? A. That's a sign of overdose. B. This is expected with this medication. C. You should stop the medication immediately. D. Apply heat to resolve the bruising. Answer: B. This is expected with this medication. Question 17. Which finding is most concerning in a patient receiving clozapine? A. White blood cell count of 2,000/mm superscript 3. B. Sedation after the first dose. C. Weight gain over 2 weeks. D. Reports of dry mouth. Answer: A. White blood cell count of 2,000/mm superscript 3. Question 18. A nurse receives new orders for a patient with tuberculosis. Which medication would require immediate clarification? A. Isoniazid. B. Rifampin. C. Pyrazinamide. D. Warfarin. Answer: D. Warfarin. Question 19. Which patient statement about nitroglycerin indicates a need for further teaching? A. I keep the tablets in a dark bottle. B. I take 1 tablet every 5 minutes, up to 3 doses. C. I swallow the tablets whole. D. I sit down before taking the medication. Answer: C. I swallow the tablets whole. Question 20. A nurse prepares to administer insulin glargine. Which action is appropriate? A. Mix with regular insulin in the same syringe. B. Hold the dose of blood glucose is under 120 milligrams per deciliter. C. Administer in a separate syringe. D. Give 4 for rapid effect. Answer: C. Administer in a separate syringe. Question 21. A patient is started on captopril. Which statement by the patient indicates the need for further education? A. I will monitor my blood pressure regularly. B. I should avoid potassium-rich foods. C. A persistent dry cough is normal. D. I will take the medication with meals. Answer: D. I will take the medication with meals. Question 22. Which medication should be avoided in a patient taking sildenafil for erectile dysfunction? A. Nitroglycerin. B. Acetaminophen. C. Lisinopril. D. Metoprolol. Answer: A. Nitroglycerin. Question 23. A nurse administers methotrexate for rheumatoid arthritis. Which lab result is most concerning? A. Hemoglobin 13.2 G/DL. B. WBC2 000/mm superscript 3. C. Platelets 190 000/mm superscript 3. D. Alt20U/L. Answer: B. WBC2 000/mm superscript 3. Question 24. A nurse is preparing to administer sublingual nitroglycerin. What should be the priority teaching? A. Chew the tablet for faster absorption. B. Lie down to avoid dizziness. C. Take it after meals. D. Store it in the refrigerator. Answer: B. Lie down to avoid dizziness. Question 25. A nurse gives 4-potassium chloride. Which action is unsafe? A. Administering via infusion pump. B. Mixing in 100 milliliters of normal saline. C. Giving the dose 4 push. D. Checking renal function prior to administration. Answer: C. Giving the dose 4 push. Question 26. Which medication requires monitoring for signs of tendon rupture? A. Ciprofloxacin. B. Amoxicillin. C. Azithromycin. D. Ceftriaxone. Answer: A. Ciprofloxacin. Question 27. A patient receiving gentamicin reports decreased hearing. What should the nurse do first? A. Stop the infusion and notify the provider. B. Reassure the patient this is temporary. C. Check blood pressure. D. Ask if the patient has earwax buildup. Answer: A. Stop the infusion and notify the provider. Question 28. Which instruction is essential for a patient taking tetracycline? A. Take with milk for best absorption. B. Avoid direct sunlight exposure. C. Take at bedtime. D. Do not take with food. Answer: B. Avoid direct sunlight exposure. Question 29. A nurse is preparing to administer heparin subcutaneously. What is the appropriate nursing action? A. Aspirate before injecting. B. Massage the injection site. C. Use a 25-gauge needle. D. Administer in the deltoid. Answer: C. Use a 25-gauge needle. Question 30. A patient taking isoniazid for tuberculosis reports numbness in hands. What is the priority action? A. Discontinue the drug. B. Administer pyridoxine. C. Encourage hand exercises. D. Monitor for liver toxicity. Answer: B. Administer pyridoxine. Question 31. Which medication should be held before a patient undergoes a contrast-enhanced CT scan? A. Furosemide. B. Metformin. C. Omeprazole. D. Acetaminophen. Answer: B. Metformin. Question 32. A nurse is caring for a patient on clopidogrel. Which assessment is the priority? A. Monitoring urine output. B. Checking for bruising or bleeding. C. Assessing blood glucose. D. Monitoring for constipation. Answer: B. Checking for bruising or bleeding. Question 33. Which finding is most concerning in a patient taking valproic acid? A. Weight gain. B. Tremors. C. Yellow scara. D. Drowsiness. Answer: C. Yellow scara. Question 34. A nurse prepares to administer ondansetron. What condition is most important to assess for? A. Diarrhea. B. Bradycardia. C. QT prolongation. D. Hyperkalemia. Answer: C. QT prolongation. Question 35. A patient is prescribed spironolactone. Which electrolyte should be monitored closely? A. Calcium. B. Potassium. C. Magnesium. D. Sodium. Answer: B. Potassium. Question 36. Which of the following medications requires a double check by 2 nurses before administration? A. Lorazepam. B. Insulin. C. Furosemide. D. Pantoprazole. Answer: B. Insulin. Question 37. A patient is prescribed atropine. Which condition should the nurse monitor for? A. Bradycardia. B. Diarrhea. C. Urinary retention. D. Sweating. Answer C. Urinary retention. Question 38. A patient taking fluoxetine reports increased energy and euphoria after 3 days. What is the nurse's best action? A. Reassure the patient this is expected. B. Educate that mood improvement takes 2 to 4 weeks. C. Double-check the dose. D. Stop the medication immediately. Answer B. Educate that mood improvement takes 2 to 4 weeks. Question 39. Which medication would the nurse question for a pregnant patient? A. Labetalol. B. Warfarin. C. Methyldopa. D. Prenatal vitamins. Answer B. Warfarin. Question 40. A patient is prescribed alendronate for osteoporosis. What instruction is most important? A. Take with milk. B. Lie down after taking it. C. Remain upright for 30 minutes. D. Take at night with food. Answer C. Remain upright for 30 minutes. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying.